From Becker's Healthcare in Chicago, this is Healthcare This Week. I'm Lindsay Dunn, Editor-in-Chief of Becker's Hospital Review. Here are 5 of the biggest stories in healthcare for the week of November 18th. This week, Jeffrey Zients, the man charged with fixing Healthcare.gov, said the site now has an error rate of less than 1%. The site is far from fixed, however. CMS Deputy CIO Henry Cha told a House committee earlier this week that between 30 and 40% of the website's infrastructure has yet to be built. Stay tuned to see if the agency meets its promise to have the site's fixes completed by the end of the month. 2 of Wisconsin's leading health systems, UW Health in Madison and Aurora Healthcare in Milwaukee, have begun exploratory discussions for an affiliation. The 2 systems said the goal of the potential partnership is to enhance the delivery of high-quality, affordable health care to Wisconsin and the surrounding region. 2 big Illinois systems also announced plans to merge this week. Cadence Health in Winfield and Rockford Health System signed a letter of intent to combine their organizations. The announcement comes roughly 18 months after Rockford canceled its planned merger with OSF Healthcare in Peoria, Illinois. The Federal Trade Commission challenged that merger, claiming it would reduce competition in the Rockford area and lead to higher healthcare costs. Late last week, CMS announced that more than half of all acute care hospitals will lose some portion of their Medicare payments in fiscal year 2015 due to poor performance. The cuts are part of the CMS Hospital Value-Based Purchasing Program. The program, created by the Affordable Care Act, withholds 1.25% of all payments to hospitals and redistributes them, taking funds from low performers and giving them to high performers. In total, 1,451 hospitals will have their payments cut in 2015 as part of the program. For our last story this week, Johnson & Johnson has agreed to pay $2.5 billion to settle lawsuits by thousands of patients over faulty metal-on-metal hip implants made by the company. The implants were found to fail at higher rates than other devices and were later recalled. The patients suing the company have undergone revision surgeries to replace their implants and will receive an average of $250,000 as a result of the settlement. That's all for this week's edition of Healthcare This Week. We'll be on hiatus next week celebrating Thanksgiving, but we'll be back in December with 5 more of the biggest stories affecting our industry.